Great to have you online, lovely to have you in the room. And we have a number of good presentations coming up, so let's just maybe start. Today's agenda is as follows. I'll be introducing HERoS. My name is György Kovács. I'm the PI, to say the principal investigator of HERoS, but we have a really lovely consortium, which I will introduce in a second as well. Then we'll follow up with Mikhail Scherenko, to talk about more epi modeling things. Then Gregoire here will talk about misinformation in COVID-19. And we'll continue with drone deliveries and more learning experiences. And the special stars is going to be with Project Hope and their experiences through COVID-19. Let me just quickly go through the next slides. Thanks for people joining still in. So HERoS is a project that stands on 4 pillars. It's an EU project, which is kind of a bit of a funny one, in the sense that the European Commission wanted to do emergency health projects, and that's not very typical maybe for them. The 4 pillars we tackle are crisis governance as one, then we do local epi spread, we have medical logistics and supply chains, and misinformation and fact-checking. These are the 4 main content areas that we do. Of these, if you just look at the project partners, you will see that the project as an EU project brings together several universities, several humanitarian organizations, but also then technology providers and companies in one. So this is why right now, today, for example, now being in the 3rd year of HERoS already, we are going to focus on things that we haven't talked about in the last years. Every year we have come to HMPW to update on how far we are. So today is just really particular issues that are new to this particular year. If you come to the next slide, please. Other than what we are talking about today, I would want to just draw your attention to the fact that HERoS has done a lot of different types of outputs. We've done documentaries about pandemic governance, including at schools and at nursing homes. We've had an arts exhibition about governance from school children. Then what you see on the right here on this slide is an ICU capacity visualization tour, which we like to highlight because it was one of the first things that impacted a lot on EU policy on changing how the EU thought about patients and patient care, and actually looking at which ICUs were overwhelmed. The EU then went so far as to then start allowing for patients to cross the borders or to be shipped across the borders and be taken care in another country. We've had epi models, behavior models in different cities, especially Delft and Helsinki. Then when the vaccines came out, we put together a temperature control fact sheet that was used in many different countries as well, and many different public health organizations for especially vaccination programs, obviously for COVID-19. And then what we will talk about today as well is a bit of the drone simulation. And Gregoire might be mentioning a bit on the fact-checking observatory and Twitter bots that we've also put together. Also today, because these are the last things we've been doing in the project, we've been putting together a massive online open course for pandemic response, and we'll show you a little bit of the logic behind that as well. So that's the overview of the project. As said, some of these will be highlighted more today. And before we forget, because this is really important, I mean, today we highlight some things, then at the end of the project, and the project is ending fairly soon, we will have a final stakeholder event in Poland, in Gdansk. And we would love to invite you already now for the 25th of May to that event. So please do join and come and talk to us. There you have a lot more, like you will have the full spread of the project, and if you have done very similar things, please also join. You're welcome having people having stands and also discuss with us and also present if they want to. But over to content. Shall we start off with Mikhail? Okay.
Okay. Hi, everyone. My name is Michael, and I'm a postdoc researcher at Delft University of Technology. That's the university in the Netherlands. And I was pretty happy to work on a very specific work package within the HERoS project on behavioral modeling of COVID-19 spread. So as we all have seen so far, that was quite difficult to predict the pandemic, right? So some people tried, and the spread is kind of it's really messy. And so while some while some modeling was focused primarily on different factors, such as I don't know, how infectious the virus and things like that, some mathematical modeling. So our approach was slightly different. We were trying to understand what people do, why they do, and so based on that, make some suggestions, some explorations. And I will try to talk today about a very specific piece of our work that we did for the last task in our work package. I will talk about simulation modeling in a data-scarce environment. Data-scarce environment, in short, when you don't have data. Oops. Right, there is a bit of lag. Just to give you a bit more, a very general idea about simulation modeling is a thing, you build the system yourself. You try to create something that will generate disease spread or traffic or something else. You really have to have a good understanding of how the system works. So now the trendy thing is a digital twin, when you try to fit a lot of data into a thing and to be super precise with your stuff, right? So simulation models, they're useful tools, and they help to generate scenarios and try to plan interventions. So what data science does allow you to do, data science usually doesn't allow you to plan interventions. But simulation models, they're like a sandbox. You can say, what's going to happen if we'll close schools? Then press the button and see what's going to happen, right? And you can do this for different contexts as well. What is tricky with simulation modeling is that, first of all, if we respond into a crisis, we have lack of time, but also we have lack of data, right? So data scarce environment can be created by, let's say, we have certain content in certain countries when you have data, but also if you try to do something for the first time, like when we didn't know what's COVID, right? So we don't have any data. So how do we deal with that? Right, so we have this dilemma here. So how we can create something such a heavily data-driven without having data, right? That was kind of our initial kind of struggle with this project. And in short, what the HERoS model does, it's a simulation model, and it simulates COVID-19 spread in the city. So on this picture, you can see some basic infrastructure, some amenities of different types. And what we try to do here, we try to model them explicitly, have a lot of information about how big they are, how many things are there, how many, for example, supermarkets, pharmacies, and stuff like that. And we try to model people moving across those locations, spending time together, behaving in a certain way, say behaving irrationally. So even though you know that you have to keep the distance, but there is no distance whatsoever. So when we have those complicated paths and people interacting and things like that, this is just a general overview of the model. And when we talk about data scarce environment and we talk about lack of data, people sometimes refer to having low, mid, and high resolution models. So imagine that you have a country, and then if we have some indicator for the whole country, this is a low resolution model. We have few or no data. For example, we have population for the whole country, right? We can do something with that, but that's not specific enough for our purposes. Then imagine that you have a country and a number of regions, right? So this is the mid-resolution data, or cities in your country. You have some indicators about those. Or you have a high-resolution data, like a grid, and then you have, let's say, to a building block data point that's high resolution, that's a lot of data, that's good for you. So you can easily build up your simulation model. And HERoS, what we try to do specifically, so we try to model something high resolution and model something low resolution, right? So here you can see on the right, you see the map, and this is the part of the Netherlands, South Holland. You have the city of The Hague, and you can see that you have multiple shapes in there. These are districts of The Hague. So we have a lot of data about the whole Hague, right? And you also see a surrounding area. You have Delft, Binacker, and other cities. And about those cities, we don't have any data. Well, we have, but a bit. So the trick that we applied here, we tried to model high resolution with like very precisely. We try to model direct contact transmission of a lot of agents. But for the low resolution model, what we did, we create so-called surrogate model. We try to replace something that happens in a high resolution with something that may happen given like low data, like a progression via system dynamics model. So what we did in a nutshell, again, we tried to come up with a like higher level model for low resolution regions that will allow us to do the same that we do for the high resolution. Well, it worked out. We came up with a series of results. So initially our model was quite small, right? Because we didn't have a data, but now we enlarged that. And even though we don't have any data, we still can come up with some predictions about the larger area, about the whole South Holland province. Well, not the whole province, but the bigger one. So to sum that up, in case if you don't have enough data, right, depending on the phenomenon that you want to study, if you want to study migration, or if you want to study a virus spread, like in our case, you can come up with a surrogate models and replace initially desired high resolution models. That will allow you to be still on track and still generate some predictions. Well, that's basically it. If you want to learn more, you can go to the website that Jonji already mentioned, or you can go to our GitHub and take a look at the specifics of the model, how we did that. Super happy to share with more details if you're interested. And here's a great team behind the model, the recent developments. Super happy to have all of them on board, otherwise it's not going to work out. And with that, I would like to, I guess, wrap up. Are we open to questions now, or like what's the format? Yeah. Okay, so I'm done. And if you anyone has any questions, happy to answer them.
If you are online, please just put your questions also in the chat if you wish. We'll pick them up from there. All right, in that case, we are following up with Grégoire on misinformation, fact-checking, Twitter bots related to COVID-19.
Okay, good afternoon, everyone. So I'm Grégoire Burel. I'm from the Open University in the UK. I'm a researcher and data scientist. And I'm going to talk about the last part that we did on the project, which is trying to counter the spread of misinformation using a bot. So it's quite different than typical approaches. So we actually know that those people spread misinformation, and we try to kind of tweet back to them basically the correcting informations using fact checks. Okay.
There's a slight delay. Yes.
Yeah, there is. Okay. So as you know, during the COVID-19 pandemic, there was a lot of misinformations around there, being spreading and people sharing those type of informations. Even after COVID, I mean, there is still continuing. For instance, around the Russian invasion of Ukraine, for instance, there is a lot of misinformations, and there is a lot of those to be checked, and it's very complex process. And most people they won't actually look for those fact check when they share informations or misinformation online. So what we're investigating here is can we change their behavior towards sharing misinformations by basically exposing them to the fact check directly. And this is the last part of the different steps. So in the previous year I presented the other part, which is basically we built a database of fact check and a way to visualize that over time and how it's spreading on social media, on Twitter. And also we created a way to understand how those spread, so how misinformation and fact check spread on Twitter in relation to each other. And this work here is basically trying to use a bot to change people's behavior, at least to affect how they think about it when they share misinformation. So how can we influence people sharing misinformation online? So as I just mentioned, basically people, if we try to people that know about fact checker, they will already look for them. So it's not the one we're actually interested here. We're interested in the people that don't know about maybe the fact checking tools. They don't know to install the tools that exist that will actually help them to know whatever they are posting is trustworthy or not. And what we decide here is to push the information to them. So it's relatively simple. We look for mentions on Twitter of misinformations, and then we tweet to them back the fact check. And how it works is that we use different templates, so to kind of check different way of giving these correcting informations. And the advantage of that as well, besides like it doesn't require installations from the users, it's also visible to anybody. So we might not change the behavior of the person that we tweet back, but it appears within a thread, so other people might see that. So it has also an advantage there. And what we want to know is at two levels. So first, what type of language is the best to convey such information, and also what type of user are more likely to be receptive when we send to them information. So as I was mentioning, so we kind of have a big database that we continuously update of fact check and misinformations, and then we search those mentions, and then we basically select at random a way of tweeting them back these informations, the correct informations using templates, and then we kind of collect data to analyze the response. The thing that is important is we don't do it fast in purpose, so we do it very slowly. So we send a tweet every 15 minutes or so we don't spam, because obviously that's direct connection to those users. So we've been running that for a while. We have around 4,000 tweets that were sent by the bot. And here's a few the templates that we use. So we have different language, from factual language to more friendly, like with smileys and things like that. And we want to see if specific language might be better and other compared to other ones. So then the thing we need to know is how effective it is. So there's different ways. The way we decide to do that is quite easy, is an indirect way. So we check what actions the user that we targeted takes after we sent the correcting informations. So they can be classified like in 3 areas. So they can be positive, negative, or neutral. So instance, positive actions would be like they like the tweet we sent, or they start following us or retweet. Negative would be they block the bot. Neutral, which can be tricky. For instance, the replies, they might be positive or negative. Actually, we use the reply here as a negative actions because 95% of the replies are negative. Delete can be another reasons as well. So it not necessarily means like, oh, we caught them. They might sometimes a common behavior is to delete, to not be caught by posting misinformation, and then they redo it a bit later on. So that's one as well. It's not necessarily the best to use as well. And if we look at the behavior, basically, depending on the type of template we use, we cannot say that one is more effective than the other one. And most of the users would just ignore, so don't reply or don't do anything. So they are not actually shown this figure, they are neutrals. And then after that, most would be negative, and around 1% would be positive, which is expected. The thing we see a very common pattern is people will kind of block us, but still reply us as well. So, or they will also do something like block us and delete, which is another interesting behavior that we observe. So what we can say is like those templates don't really work, but we might want to use more personalized approach or more personal message, or like visual messages, for instance, could be another way to do it. And out of the around 4,000 posts we sent, we got around 200 responses, and 95% are very negative. A few appreciative, so that was nice to see. So yeah, we are big pharma. They are anti-bots, or we are paid a lot supposedly to post this type of information. So yeah, then quite a few other ones that are interesting to look at. And the second part we wanted to see is what type of users might be more positive to the bot. So we hypothesize that maybe the users that don't always post misinformation, they are more like balanced, not as polarized, they might be more likely to be receptive. So what we do is we use a tool that we developed called Misinforme that will analyze Twitter profiles and will provide a kind of a ratings depending on what they've been sharing in the past. So -1 is a lot of misinformation and 1 is like more reliable information, for instance, on mainstream. If you want. And then basically we can analyze the response. And also for that, what we observe is there is no like clear, not significance between the different groups. So you wouldn't say like, for instance, one group that is, for instance, more positive has, let's say, a higher rating from the Misinforme. And actually, if we look, it is not significant, so we can't say much. We can actually see more the opposite, in fact. So that's also because how we target those users. So the user that are targeted, they are more likely to be sharing misinformation already, so they tend to end up in the same group. So it's very hard to distinguish them. So as summary, so we kind of, the response are mostly negative, but we have some encouraging results, like very few, but some. And there's many things we haven't looked at. So for instance, the impact on users that actually seeing those tweets, not the one that are targeted. So there might be a bigger impact there. For instance, we could also see like other users that maybe, yeah, so the one that follow the conversations, or we could also improve that by, for instance, personalized messages and things like that. We're a bit worried by that last tweet about telling Elon Musk about us, but otherwise fine. I'm not going to read too much on that because we're running out of time, but basically we're also investigating the impact at the spread itself. So that's something we are working at now. And in terms of future works and in future what we are looking at in the 3 different areas that I mentioned at the beginning. So in terms of monitoring, so for instance, spreading to beyond COVID, for instance, the COVID database now it's not updated anymore for fact check. So we have obviously followed the Russian war, and also we are collecting like general fact check. We have 152,000 fact checks at the moment. And also like analyzing a kind of difference between crises, which is something we are looking at. All the behavior is different between COVID, for instance, and the Russian invasion. Prejudice is another thing we are looking at. And in particular, for instance, if looking at countering, right now we are trying to we have made a proposal with some fact-checking agency to kind of look at prejudice and how particularly how the fact-checking agency could improve their practices depending of the type of misinformation they are looking at. So that's yeah, that's pretty much from me. So if there is any question.
Thank you. Any questions in the room? Any questions online? Misinformation, fact checks.
Yeah, thanks a lot. And I think it's very interesting to report back the lack of lack of impact, right? So like what you would expect, or like what would you hope for? You will hope for like you made a bot and bot did well. So you report like the actual things and the people like, yoo-hoo, now we are informed, right? So I still wonder like what kind of like behavioral theory can explain that? Because I believe that, if people strongly into something, like it really takes quite some effort into like, trying to shake those like strong beliefs. And I don't know, like to what extent, even with the large language models, to what extent you think that you can go further in like shaking those beliefs, and what's your like, what would you aim for?
Yeah, there are different issues. So one of the big one here is we kind of go directly, which can be a bit tricky as well to do. So engaging in conversation long term might be a bit complicated. The thing that we know from studies, different studies, is that the direct approach in general doesn't work very well because people are defensive. If you tell them like you're wrong, they won't take it nicely. So a way to deal with that, for instance, is kind of doing like lateral fact checking. So instead of telling them this is the fact check that correct you, maybe like this is the sources you could like look at. Maybe not a fact check, but sources around there, and try to have a balance. So more like encouraging them to look for themselves rather than correcting them straight away. So that's kind of where we could look at, for instance.
Yes, please.
Yeah, yeah. I find it really depressing, to be honest. And I don't think there's any other way of getting the message that's going to change their mind. I think even if their own mothers came, or their own sons or daughters or family members came with a fact check, that it would be ignored. Because I think this is so now bound up in identity. And I work for WHO, and I've had people I've known for a long time accusing me of being involved in a vast conspiracy to do one thing or another. And these are former friends of mine. And there's absolutely nothing you can tell them. Even say, look, I mean, WHO doesn't have the ability to conspire its way out of a wet paper bag, to be honest. Having worked there for 5 years, I mean, the notion is utterly incredulous. But I think it's just so bound up in identity. There's just, people are not going to move their positions on this. And even if you provide verification, somehow or other they use it to reinforce their worldview. And I think it's a really important conversation for the age. And certainly you're right, not just in COVID misinformation, but you see similar going on around Ukraine and around China. But I mean, fascinating work, and thanks to just to understand the phenomena, I think is worthwhile. Changing those subsets of mindset, I think, is going to take something a lot more, but at least knowing how it's operating, how it's out there, how it feeds off each other, it's a good first step.
Yeah, and an interesting thing we observe is like when I look at all the replies, which is, it's not nice to look at, like some of them, that's interesting. So they will try to flip the argument, or they will just say, oh, look at those fact checkers, which are fake fact checkers. So they exist as well. So they will cite other things, or like, well, all the possible ways to try to turn it around. The thing that is we tried a bit and didn't work with that approach is to, rather than trying to correct anybody we can find, is to try to find the one who might be able to change, because the one that are already too much into it, there is no way we are going to change their mind, as you're saying. So the idea was like, this one didn't really work, I think, because of the distribution we got, like trying to find the one that tends to do a bit of both. Maybe they are more likely, because we had some cases actually that responded to us like, oh, I thought it was true, and so it happened maybe 8 times. but it happens. I mean, it's still a win, even if it's not many. If we do that at scale, that could be a lot of wins actually.
Okay, we can take also more questions at the end, but I'm gonna now, in the interest of time, a bit move on to drones, to quarantine zones. HERoS has had quite a massive part on medical supply chains and medical logistics, and especially on like any kind of disruptions in medical supply chains. This is the last part of it. Very much in the beginning of the project, we were looking at drones because we were thinking of like, that could maybe help in overcoming contagion. It might help in, for example, in the very beginning of the COVID-19 pandemic as well, there were quite enough truck drivers who didn't want to go to certain areas because they were thinking of getting stuck. So this is kind of an idea that developed from there. The last time we were presenting very much of the actual drone simulation, but just to maybe recap some of this, we are not talking of these little buzzy things that bring you your pizza or coffee, okay? The drones we are talking about are actually high payload, 150 to 200 kilograms, and on a long range flight. So this is 500 to 1,000 kilometers that we are really targeting here. And the simulations that were run were simulations mostly to, for example, BD camp. Some of the simulations were meant for crossing borders and including like all the issues with it. So in the beginning, we, for example, went through the workflows for loading, unloading, what do we need to take into account, who is allowed to actually receive any kind of medical item in different countries. So those kinds of things were the really big issues. Now, when it came to the simulation, it was also like the technical bits, like how do you really operate it? What are the issues on the ground station, on the connection to the drone? How do you actually know? How do you know how to land? Things like that. There was over 1,000 hours of simulation in the end, so it's been heavy, and that part you can see them more, I think, also in at the Gdansk meeting. Some things maybe to highlight. So why did we look at drones? I mean, I mentioned contagion and implementation of health measures and especially quarantines. But we were also looking at like, okay, do we actually cut costs by delivery? So do we reduce traffic in certain areas? Like in Poland, drones have been actually, for example, used in COVID-19, not this size, but for medical deliveries. So there are some things that you can do. Drones have been used, for example, now I know in Austria, smaller ones for bringing test swabs to people in the Alps. That has been a bit of an experiment with that. Again, as I said, this is a much bigger thing, and with much bigger things come much bigger problems, to be fair. So what did we discover in this whole simulation? One was to look at regulations. And if you think of the long-range flights, I mean, one of the ideas would be to deliver across borders, for example. And then not only do particular nations not have any regulations sometimes for drone flights, but then, of course, how you fly across borders is like a complete mess. So luckily, Squadron, the drone company that is developing this site, they're very well informed and very well connected with EU regulations and with IATA. So they have come forward now in the project also with quite specific recommendations of how to implement this on the legal side. Then there are many organizational issues we came up with. Who should be certified to operate a drone safely, for example? It's not a given, especially when it comes to, for example, I mean, think of the 150 kilo just dropping. I mean, you might want to think through that. And then, of course, technical issues. We were focusing on operational reliability, but I mean, cybersecurity would be a big question as well. So that's basically the main takeaways from this. When it comes to security threats, I just mentioned, but the beyond visible line of sight is a challenge, generally speaking. I mean, again, some countries do run it quite successfully. I mean, if you think of the zipline drones in Rwanda, but this being bigger has a bigger issue as well. So there are some recommendations that come out of it. I'm going to be very fast so that we can also come to the discussion about it and to other things. But very obviously, one big one is about air traffic control and legislation. Another big one would be even just customs. How do you do that with drones? We haven't come to any good solution to that yet. We can simulate the flight, but then there are certain things around it that are still sticky points, especially, you know, thinking about who's actually receiving the item. So there are things like that. Liabilities, insurances. So the funny bit at the end of the day is that technically what is possible is more than what we can legally at this point see. So there is a huge issue about who is liable for what, who does what, especially once you're crossing borders. So this is basically the main points from the latest drone simulation. We will show it, and we will have an entire stand in Gdansk. And in fact, one of the reasons that the final conference of the project is there is that the drone simulation is also there with the full hub and setup. Any questions to drones? Again, if you're online, please just put it in the chat. We have a person monitoring the chat, even if I cannot see it. So it's Silvia Rossi from WFP. Well, it doesn't surprise me that cross-border is messy. Yeah, and I don't think it's going to be solved very soon. And also, even for custom clearance, there is a whole meeting going on from 9 a.m. this morning till early afternoon to cover that. So I definitely see that it's a serious issue. So is there also for this drone that you have developed the opportunity to move commodities that require temperature sensitive conditions? Yeah, so we did go through temperature control, vibration control, noise control, things like that. So a lot of those things have been taken into account. And yes, the drone can manage many of those. So that I would need to cross-check with the company now whether we managed to do the ultra cold chain as well. But we did have temperature control as one of the big topics in the development of this, especially when the vaccines came about. No, exactly. But also I'm thinking, so in a simulation we did last year in Malawi, we actually simulated the use of drones to reach health facilities that would be cut off by flooding. So it was quite crucial because there would not be any other way rather than flying some sort of vehicle there. And yeah, the use of drones was actually preferred to others, and it seems to be appropriate for the challenge, really. So, and in that case, it was actually a much smaller drone, but it could contain a cold chain box, so it worked. Thank you. Yeah, same ideas here, and this is fine. This is quarantine zones, but the whole point is that it is locations you can't enter that easily, so it could be a flood. Same way. Yeah. Good. Shall we move to the next topic?
Okay, this is Abdul Salam from Hankin. I work for HERO and other projects. We're talking now about MOOC, massive online open courses. This course came out as a result of HERO. I mean, we combined a lot of training courses that have been conducted during the project, and also webinars, and also some of our findings from the deliverables. I mean, and some of the experiences that have been shared by our partners, Project Hopes and other partners. So we combined all those together, and also to expand the audience of the training. So we made that online, and it's for everyone, and it has been running since the 20th of March, and then we finished the first batch of that course. So the course is all about the health emergency response to a pandemic. I mean, from the lessons that we've learned from HERO, so epidemiological modeling, governance, crisis governance, medical supply chain, misinformation. So we learn a lot. So, and we put all those together to feed the general audience. And the course is really have rich content for everyone. I could say that, because you can pick the topic that you are interested in, governance or information or medical supply chain or whatever that you like to attend. And you don't need that much time. It's online on Future Learn, so you can go at your convenience. You can pick the time that you can attend the course. And also there are some options with certificate, if you need to have a certificate, if you don't need to have a certificate. So really that's course one of the we can say that the product of everyone participated in HERO. So because everyone has put some input in that course. So we are really proud of that. So the course has been designed to be for 4 weeks. I mean, based on 4 pillars or 4 topics. So you can go through it, but the time, it depends on you. That doesn't mean you need to stay 4 weeks to complete the whole things. But if you're faster or fast learner, so we can say, so you can take so many topics in a short time. And so week 1 is behavioral and epidemiological model. The second week is governance crisis, then securing medical supply chain, and then social media analytics, and the wrap up of the course. So learner can go through all these topics and then they can find so many interesting. That doesn't mean all the courses are like a content or article you need to read. No, there are like so many interesting videos, recorded videos. Some cases have been also shared. So you can find different means to learn. I mean, it's not only just to go and read the content of the course. Really, you can see here, these are some topics or in 8 weeks, so from week 1 until week 4. So really in healthcare data, computational models, visualization. So then the end of week, there are like some polls and some tests if you want to go through those things. If you want only to learn the things so that you don't need to go through the test. I mean, you don't need to take the test. If just you need to learn it as knowledge, that's it, that's your option. Also in week 2, we have crisis governance, we have societal also resilience in time of crisis, using visualization model or visualizing methods. And then what can we learn? This is like an experience from COVID that has been also extracted from our research findings. Then week 3, it's about medical supply chain. So the whole idea about supply chain, medical supply chain, disruptions, preparedness, and response, last mile delivery, including then the drone. Drone is one part of the last mile delivery. And then impact of COVID on the medical supply chain. And then finally, this part related to misinformation on social media. So social media analysis, misinformation, as what Greg also presented, the whole idea about social media and misinformation. So this is in general the content, and then you go through it. I mean, here I'm just showing the topics that have been also discussed, but you will find more breakdown in the Future Learn platform. So the videos and the case and the articles, what you need to go through, and additional also sources that you can go if you are interested. Also, one of the most interesting things that during the facilitation time, people were interacting, they were sharing their own experience. I mean, it's not only the content from our side, but we managed to get some feedback from people, personal experiences, or even professional people, those who really had experience with COVID. They maybe were working for a restaurant, or they were working for a hospital or any other services point. So they were really also saying a good comment about their experiences and what they have learned from that. So, and we were trying also to develop that content so it can be a new input for the coming batch in our course. So there are like some options, as I've said, that for people those who are interested, you can go to one of these options. If you want to pay, or if you don't want to pay, if you need a certificate, you can pay. If you don't need a certificate, you don't need to pay. And those, but the package is changing, you know, around the time, because it's not fixed, but it's free for those who only need to learn the content. And these are some statistics from the first batch. You can see here the number of people, over 133, and then they were participating. Some they were commenting, some they were watching, some they were reading. So you can see a lot of activities are going on until now. Some people are roaming around. So really, it was interesting, and even the number was quite good number from our student and people from outside across the globe, definitely. And then this is the certificate and transcript. If you completed the course, and you can get it online simply. I think in a brief, that's all about our MOOC online course. So we are inviting people just to go and see what is there. So you can pick, or you can recommend the course for any person to take it. Thank you so much. Any question?
I don't see any questions online.
Yes, please.
So I thought MOOC was standing for open, online, and free.
And it is, and that's the whole idea. MOOCs are open and online. When it comes to platforms, they sometimes want to get paid for it. That's the problem with some of the platforms, for certificates, not for the actual learning. So we don't get paid for any of it. But the Future Learn platform, if you want to get certain certificates of it, then there are packages for it. They also, the pricing, which is a bit misleading to show any pricing, to be honest, because it depends on where you are in the world. But as said, it's not something the universities or any of us get paid. It's the platforms that want that.
You can take the course completely free.
You can completely take the course for free.
Without the certificate at the end.
Yes,
Yeah.
without the certificate in the end.
That's because that's kind of what I thought MOOC was.
Yeah,
Yeah.
That's the whole idea. I mean, to be fair, very few people want the certificate or need the certificate for anything. And that's also not the idea here. Also, what we do at Hanken, for example, we do have Hanken students taking the MOOC, and then they do another assignment, like kind of more in depth, and then they can get credits at the university. But that's a tough one for us in the Finnish university environment. We can't do just online education, so it has to tie into something else.
So you've gone out and collected a bunch of stuff that's available through MOOC and then packaged it together into kind of a learning pathway that's been done by then you guys with then the option to then have a certificate that through that learning pathway you have completed X, Y, and Z. So that's the kind of polish you've put over the gathering of that of those courses into something that's a discernible pathway to learn something.
Exactly,
Okay.
and this is the whole idea that, I mean, HERoS as a project brings together so many different topics and areas and knowledge. So this is a bit like packaging that into a course. And that's why it's 4 weeks. So every week has a different big topic, moving on to another. And it reaches out to very different people. So if you look at the actual profiles of the learners, which we do have some data on as well, I mean, first of all, the advantage is that it is online, so we do have quite a global audience, but also we bring together people from public health organizations to people who work in various governments to just students, to anyone. So it makes it a bit more open. That's the idea.
And then for anyone can go in and see the coursework, so the different modules, and poke around and see what it's doing.
Yes. To just click and start off.
Okay.
Yeah. Shall we move on to Project Hope?
I've got it.
Can you turn, Gregor, can you turn that computer this way? Thank you. Would have been fine. Yeah,
Yes.
would be
thank
good.
you. Otherwise, I'm going to get a kink in my neck trying to look way up there.
There you go.
Perfect, thank you.
Does that work? Can you see? You want to go
So,
ahead?
Yeah. So my name is, can you hear me? Yeah. My name is Emilia Dukovsky, and I work for Project Hope as a development and finance manager, and also a member of the emergency response team of Project Hope. We are here with Barbara to share a little bit more about our experience with the COVID-19 response on a global level. And that's it from me. Barbara, you want to take over?
Sure. Hi, my name is Barbara Smith. I'm a senior program officer. I work at the headquarters office. I work specifically with all the programs that we have in China, which is the reason why I was chosen to lead this particular project. From the headquarters perspective, I also work on non-communicable diseases, even though COVID-19 is communicable. So it was an interesting project to work on. So we wanted to share a little bit of Project Hope's experience that we saw throughout the pandemic as we responded around the world to the crisis, and what were some of the things that we saw and shared with HERoS as they did their research. So we were actually there at the very beginning. We have been registered in the country of China as a non-governmental organization, an international one, since 1983. So if you did the math, this is our 40th anniversary of being in the country of China this year. And in 2001, we helped to establish the School of Nursing at Wuhan University. So we've been training nurses since 2001 on every aspect of being a nurse. So the nurses who were responding at the beginning most likely went through Project Hope's School of Nursing at Wuhan University. It's actually called the Hope School of Nursing. So we were there at the beginning. Since we have such a long history with the government in the country, and the government is well aware that Project Hope is a trustworthy organization, they came to us immediately asking for help, because with the pandemic having everyone sick, there were warehouses shut down, so they weren't able to produce their own PPE, and they needed help to get it brought into the country, and they came to Project Hope immediately. So we actually started pulling together PPE and medical supplies as early as the 3rd of February of 2020. And within a month, we had delivered PPE to 27 hospitals across 6 provinces in the country. One of the other things that we saw that was a problem that actually began in China is they not only had a problem getting the PPE that was already manufactured, they had a problem getting the raw material to make the supplies. So that added to the difficulty of the supply chain. So then we partnered with Brown University to develop a curriculum that would train healthcare workers on response to a pandemic. And that started in late March, and it went online and has now trained a lot of healthcare workers around the world. Emmy is going to talk about that in here a little bit more. So after that, by early March, we were also getting requests from 8 other countries to come and help with providing of PPE, providing of volunteers if they could get in the country to come, medical volunteers to come and help and respond to the pandemic. And since then, I don't know how many countries we've actually responded to across the time of the pandemic, but it's been pretty extensive. So I'll hand it to Emmy for the next slide.
Thank you.
Oops, I went backwards. Sorry.
Okay. So just to add on what Barbara said, the reason why Hope is part of the HERoS project is basically this, because initially we thought that COVID started in China and it will be localized there and it will be done in a month, right? That's when we started the relationship with the consortium and wanted to share as an implementing partner our experience in China on the emergency response, which is the same thing that happened with the training we developed with Brown University. It was initially intended to be an in-person training based on the experience in China, so we are prepared for other pandemics than COVID-19. Unfortunately, we all know what happened, so we had to adjust the materials and make it an online program from then on. So as we can see here, we had different modules included starting from infection prevention to surveillance, triage, diagnosis and management, to communication of the risks, and case studies and simulations for skill practices. As a result of the very successful rollout of this training program, we then had a separate module on vaccination when that part of the response started worldwide. As of now, we have trained nearly 100,000 healthcare workers around the world in over 40 countries. In every country, this training was localized and adapted to the local conditions, first of all, and also translated to local languages to make it much closer to the healthcare workers. So this was one of the main activities, I would say, of Project Hope on a global level from the very beginning. Yes. So aside from that, as Barbara said, we had quite, I would say, a busy period where we responded to many outbreaks in many different countries. We donated medicines, medical supplies, equipment. We worked with local partners in countries where it wasn't possible to go directly because many countries were under total lockdown. There were no flights. A lot of the stuff wasn't also available to travel in the time, especially before the vaccines came out. So our experience and challenges during the COVID-19 response is that, as Barbara said, we were the only organization that could import humanitarian assistance to China, specifically to Wuhan at the time when the crisis started. We had a lot of planes that went from the State Department of the United States to pick up American citizens from Wuhan were filled out by our supplies and our partners' supplies to be taken to China and then use the space of the flights properly. So that was one of the biggest benefits, I would say, our presence in Wuhan at the beginning. Many countries stopped export of PPE because they had to respond to their own pandemics, one of them being India as well as one of the biggest exporters as well after China. Also in that time, we had issues in countries like Nepal where just because it was the only country from where they could import supplies by land, and India stopped export. So countries like Nepal were not in a very good situation. So by working with local partners in these countries, we also managed to support the health systems, even though there were challenges. So I would say contacts and networking were really important at that time that allowed us to get over the obstacles we found on the way. So once the China PPE manufacturing was back, then also thanks to these contacts that we established earlier with importing supplies and medicines and equipment to China, then we were one of the companies on the priority lists of these manufacturers and could then easily get supplies faster than our other partners, I would say. Then, as I previously mentioned with the Brown training, adapting all our training programs for healthcare workers to online courses enabled us to train as many as 150,000 healthcare workers globally. So aside these two trainings that we developed with the Brown University, we also worked with New York Health and Hospitals and used their training curriculum on mental health and resilience for healthcare workers, and then rolled it out again globally to support healthcare workers in this difficult time of burnout and stress and working long hours. And then as a final, but of course not the least important, for us very important partnership is the HERoS consortium with which we could share our experience, and we hope that we will then be able to reach out many people than we could before. It's a unique experience for Project Hope. We haven't been in a partnership with European partners so far, so we hope that this would be a great start and kick off of many more collaborations. Then I'll turn it to you, Barbara. Okay, thanks.
So when India had its second wave of COVID starting at the end of or in the middle of the month of April 2021, we actually had our longstanding partners with pharmaceutical and medical manufacturing companies coming to us asking us if we were going to respond. And then the government, even though we didn't have an office there and we're not currently working there, they came and asked us to help. So we decided to respond to that second wave in India, and I ran from headquarters that particular response. The biggest challenge in that particular instance was there was rapidly changing needs for medical supplies. Most of it was related to oxygen equipment, and at the beginning they were wanting oxygen, basically manufacturing units that are huge towers that create oxygen that would be housed in the hospital, so they would have a continuous supply. Those were the first things. So we were trying to figure out how to get those, get them in the country because they were not manufactured. We had to bring them from outside. The only ones we could get were from China, but India wouldn't accept the ones from China. So those are some of the problems that we experienced. And by the time we figured out where we could get them from, they didn't need them anymore because they figured out how to get them. So now they needed something else, and it continued to change as we were responding to that second wave of COVID in the country of India. So we did end up partnering with 3 different local NGOs, again, because they were on the ground where we couldn't get in because they were on a lockdown again. They are on the ground knowing what is needed, knowing their own communities and their culture and the situation. So we partnered with them to actually implement the response and in trying to get oxygen-related supplies as well as PPE into the country. So we worked in 6 states that were hardest hit within the country with cases of COVID. We ended up reaching either with messages online or leaflets or coming to vaccination screenings or what have you, over 1 million people in the country, and helping to dispel some of the myths and the misinformation that they were hearing. We did a lot of work person to person with that, as well as, again, those leaflets and sharing of information on social media channels within the country of India. 14,000 healthcare workers did go through COVID-19 training. These would have been ones in person in the country that could gather at the time. And they were taught about health behaviors, vaccination, and personal hygiene so that they could go out and share with their communities what were the appropriate behaviors to have to reduce the risk of COVID-19. And a lot of those were your frontline healthcare workers. In India, they're called ASHAs. So they were learning firsthand what were the right behaviors to take to reduce risk. So the medical equipment was donated to 33 different child-friendly health centers so that not only adults would be cared for, but children were specifically vulnerable to that wave of COVID. And so we worked in a lot of hospitals building up the capacity for treating and screening children. And we actually worked with a well-known hospital in New Delhi to build a new ICU unit and supply it with oxygen-related equipment. So that was a little bit of our experience in India. And Emmy's going to tell you about Nepal.
Yes, just a little bit and very shortly. As I said, it was specific responding to Nepal because the whole world was looking at India at that time. And so we experienced this. The country was totally under lockdown. There was no flights to the country, so we couldn't send any humanitarian assistance there by air. We couldn't send by land because, thanks to the Himalayas, we can only send from India. That was not allowing export at that time. So again, we partnered with local organizations and managed to support, especially around when the Delta variant struck. And we were really successful in very hardly reached areas in the mountains where assistance was not supplied by that time. As I said, partnered with a local NGO, and within 9 months of the project, we trained around 10,000 healthcare workers and supplied near 3.5 million worth of PPE and other medical supplies. This was enabled with local procurement, but also with the charter flight that was, thanks to our partners, delivered to the government of Nepal and then shared throughout the country with all health facilities. I would say it's a success story just because of the really specific environment of Nepal and natural also conditions that are hard. We were really thankful to have this strong connection to local partners that could secure and do local procurement at first place, because not everywhere this was possible. So just shortly about this, again, later, if you have questions, we can answer with more specifics. And then Barbara will share a little bit more about our experience with the MOOC training.
So I guess it was the middle of last year, we, in one of the meetings that we had for the HERoS Consortium, all of the consortium members went through the training that basically got turned into the MOOC. We realized it would be really helpful for our emergency response and logistics teams to go through the training as well. So we asked if we could have it replicated at the December meeting when we were gathering in Macedonia. So we brought together our 20-person emergency response and logistics teams that are literally living all over the world to participate in the MOOC training. And it was a really informational and interaction session that our teams were able to take away a lot of really good information that they could use, and not only in continuing to respond to COVID-19, but in other disasters and emergency responses. So just quickly, some of the key takeaways that they mentioned to us that they brought back were about the new innovative solutions for delivering medicines and medical supplies. Specifically, they were pretty interested in the drones and thinking about that. At the beginning, we were thinking, how would we get a drone into a lot of countries, especially India and China, but they were really interested that there may be some new innovative ways to try to get supplies into lockdown areas. Also, the information about how to address fake news in times of a pandemic or other crisis situation, that was really helpful, because they were seeing a lot of that fake news as well, and it was very frustrating to all of our teams to see that, you know, people were so hesitant to get vaccines to reduce the risk of infection. And then using the data and predicting models to inform public decision makers. That was another really good takeaway that they enjoyed. So that was our experience with the MOOC, and I think that is our last slide.
Thank you.
So does anybody have any questions online or in the room for either of us?
Thank you. Last rounds of questions, especially to Emilia and Barbara, but also to anybody else. Yes.
Just on the first one on the data modeling in Holland, because I didn't see it up on the screen. I assume then that after all that was done, did you do a retrospective on what actually happened and how accurate was your presumption and forecast?
Yeah, that's a very good point. So with all simulation modeling that we do, we try to verify and validate the findings. So for the stuff that we did specifically for Holland, that part was for the first wave. The first wave was sort of like the easiest to model and predict, because people behave sort of like very homogeneously, at least for the Netherlands. So we managed to be within like sort of like acceptable boundaries of error. So for that part, the further you go into pandemic, the more effort you need to kind of like the more effort you need to put into how you model people's behavior, right? So the second, the third, and the fourth waves for the Netherlands were like not so homogeneous. So it worked out pretty well for the first wave.
So was that then each subsequent wave it became less accurate?
Yeah, this is correct. So if we're going to use the same model for the like second and the third wave, that's going to be not as accurate for the first wave. For the second and the third wave, we tried to model people's behavior slightly differently. But what we also found, well, you can have multiple theories, behavioral theories, that will well explain what happened. So for example, say that people behave in a certain way because they're afraid. Right. Well, if you put that into the model will give you pretty good results. And say the people behave just randomly and they're afraid of fines that were at that point in the Netherlands. You also have pretty good predictions, right? So we face the problem that we have so multiple ways to come up with the same accurate results. Well, for the second and the third wave, not as accurate for the first wave, but still you have multiple theories that explain well what's happening, right? And that brings us to a kind of like a different question, but yeah.
Any questions or comments online still? Okay. If you guys don't see any either, then thank you everybody for attending the session. And let's just continue conversations over coffee.
And remember the event.
Yes, remember the event. Please do come. Please do sign up. Very good point. The project ends in May, so this is really the last event where we get people together. It's not online, it's not hybrid, it's just an only face-to-face. So if you can't come, send your colleagues. We will actually show the documentaries as well at the event, and bits of the arts exhibition and the drone simulation itself. So it's going to be a lot more touchy-feely. You get to see it really a lot more.